I'm Michaela Gardner. I'm a registered nurse at a local birth center here in Lake Charles, and I'm going to be talking about the importance of providing breastfeeding education and support to new mothers by nurses and the problems that we are seeing with that. So when kind of diving into this research, I spoke with my mentor, Ms. Morgan Ravier. She's a discharge educator at my hospital, and we just kind of decided on what we felt the reasons for patients not receiving the best breastfeeding support and education were, and these are just a few of the reasons that we came up with. However, there were surveys that were handed out, and we had about a 60% return rate of those surveys, and they kind of agreed with our conclusion, which were that nurses are simply just undereducated in these topics and don't feel comfortable providing that breastfeeding education and support to their patients. And then poor time management and prioritization skills were also noted. People felt that other things were more important than going and doing breastfeeding when mom could just give a bottle instead, or pushing it off, when really, if you think about it, you're starving a newborn at that point. So we kind of reviewed that and how we can make changes to that and help them with their time management skills to ensure that this education and support is being provided to the mothers, and we'll get further into that later. And then also another problem that we noted, that some nurses are just simply pro formula and believe that formula is better than breastfeeding, and that serves another issue that we will address. So the first issue we found that provided room for this to occur was that nurses were undereducated and uncomfortable with providing breastfeeding education to our patients. And this is simply from like rapid orientation, new grad nurses not getting orientation with lactation, so they've never actually seen this, or maybe they don't have children and they've never experienced breastfeeding, so they don't have that added education and knowledge on the topic to provide it to their patients. And then as well as the current orientation is just simply not sufficient. We're not having quarterly education requirements. Our annual skills fair actually includes all the skills on our unit, and we don't really have something exclusive to breastfeeding, so there's a lot of distraction, a lot of movement, and rapid fire topics that are going on in the mother baby skills fair that happens annually, and we feel as if this is affecting our breastfeeding education and knowledge in our nurses. With research, I found that at many hospitals this is an issue. The nurses just don't feel comfortable because they're not being provided the education that they need from the hospital itself. They're not getting that education and orientation that they need from lactation consultants or even the perinatal educator at the hospital. So we feel that properly educating our nurses by giving educational hours to round with lactation, maybe even 2 shifts or 1 to 2 shifts, just to get that on hand one-on-one time with a lactation nurse, educating on not even just breastfeeding, even engorgement management, and they even do bottle feeding if the mother's running to bottle feed as well. So just getting that education in with all nurses to be round with lactation consultants will really help us out. Having quarterly requirements for online education. So right now we have just a annual push out of Health Streams Education. It's our online education course, and we're looking into making this a more quarterly thing to make sure we're keeping our nurses refreshed on this education and it's staying at evidence-based level. And then our annual skills fair does include lactation. However, we're making it more an exclusive thing where there's going to be a breastfeeding skills fair on its own with our 4 certified lactation consultants. And these are all being currently made, and our patient satisfaction scores within our breastfeeding section is actually going up already, so I'm glad to see that. The next thing that I would like to address is that poor time management and prioritization that I was talking about previously. So some nurses feel as if they don't have time to stop and assist with this, or they put it on a low priority at their to-do list. Say they have medications to give, and they have baby baths to do, and they have all these other things that need to be done. But we need to realize that this is a baby's source of nutrition, and stop and make sure we're making those newborns eat, helping the mother, educating the mother to make sure that she's able to do this on her own when she goes home. And then a lot of stuff that goes into poor time management and prioritization we found was laziness. So nurses that are just not interested in helping with breastfeeding, and the lack of support in the hospital can actually make their breastfeeding journey when they go home a lot less successful. So we really want to address this. Laziness cannot be tolerated, and we are not willing to keep nurses on our staff that do not support breastfeeding, as this is a very beneficial journey for a newborn, and we want to ensure that everybody gets a fair chance at this. And the newborn's feeding also should be a high priority. I put this in here just because we need to realize that hypoglycemia, hyperbilirubinemia, and other severe side effects like temp drops and stuff all happen when we're not getting calories in our newborn. So we need to make sure that we're doing this. Being pro formula is kind of an aggressive topic to me. I feel as if being pro formula should not put a damper on your patient's experience. You shouldn't be pushing bottles on a patient that wants to exclusively breastfeed. You can offer both, but if mom expresses that she wants to be exclusively breastfed, if you can't provide the needs that she wants, you need to consult another nurse on your unit. Make sure that you feel comfortable in your other nurses and your lactation consultants, consulting them for help. Adequate breastfeeding practices have the potential to save many lives, and it seems as if that many think that formula is just the easy way out, and that's why they want to push it. But we need to realize the benefits of breastfeeding, and also our own biases cannot affect our patients. So these are just some of the current changes being made on my unit. I talked with my perinatal educator, my mentor Morgan Ravier, and my director, and we kind of all agreed upon having these changes being made, and actually most of them have already been started and are doing very well. Nurses are agreeing and complying with our new practice, and our patient satisfaction scores are going up. So currently we have our educational workshop planned for 3 different dates with different times in September to ensure that everybody is able to go, because this is a mandatory workshop. At this workshop, all 4 of our certified lactation consultants will be there, so they have the opportunity to teach and answer any questions that all the nurses may have. This educational workshop will only have breastfeeding being taught, so there's no reason for distraction as there was previously in our annual skills fair. Quarterly online education models are always being pushed out, but they're being pushed out more often now, and they're being used to refresh memory and ensure that we're keeping up with evidence-based practice as well in between these workshops that we're able to provide our nurses with. And then educational posters are posted throughout the unit and will be changed out pretty often, just so that we have something to reference on the unit, paper form, easy to access. And then also our lactation consultants are also telling our nurses how to address just simply the breast exam. Breasts are very vulnerable parts of our bodies, and we want to make sure that are making our patients feel comfortable while we're doing these breast exams and assisting in breastfeeding. So I titled this slide How We Get There. So this is just simply how we got to the conclusions we did, how we plan to see how we're doing, and what we need to get to our goals. And so first we did surveys given to all the units and all the nurses to see where they felt they lacked in breastfeeding knowledge, to make sure that we were gearing our mother-baby skills fair for breastfeeding towards our needs. And then collaboration is also needed to get there. We needed to collaborate with the mentor, my perinatal educator, my director, other nurses, everybody together to make sure all of our concerns are addressed and we make the biggest impact by making these changes. And then, of course, compliance. We need all nurses to be involved in this change, and if we feel they're not being involved in this change, we need to seek answers as to why they do not want to make the change and what can we do to better help them. Plans to evaluate our change will be done in a year's time with the involvement of leaders and healthcare staff. Everybody will be involved. We'll do that survey again to see if they feel more comfortable and educated on the topics, if they feel that they lack in this other area, what they feel we could do better, what we feel we could do differently. That collaboration will still be a part of this. Our patient satisfaction surveys will be a major part on how we see how we're doing and how we're affecting the major portion of our patients. While I did only directly quote some of these in my presentation, I did use all of these collectively to come to the conclusions of what I put on the slide, so I wanted to include all of my references that I've used over the time of my research. Thank you, and I hope you enjoyed my presentation.